Hello, this is Dr. Richard Steele. I'm here this morning to talk to you about diabetes and what we do here in our practice. As you can see, I'm right here getting ready for my day. So, my question to you, how many of you have a family member with diabetes? Raise your hand. How many of you have patients or family members that you know with complications of diabetes? So, the question is, all of us need to remember that diabetes is a condition that as we get older, most of us may or may not suffer from it, but we know someone that will. The way I can explain it is that lately we have seen numbers that are going up as far as the rate of diabetes. Right now in the United States is roughly 10.5 or 10.2% of patients in the United States will have diabetes. That's about roughly 1 in 10 people. But unfortunately, being Hispanic, because of our background, not only our genetics play a role, but also our inheritance on how we eat, our food, our diet. We have a higher rate of diabetes, which is roughly about 12.5%. But we have good news. I'm an optimist. You need to understand that we have great tools right now that we can use to control diabetes. And the way I present the information to our patients and how to manage their diabetes briefly is going to be in three things, three keywords that I always instill in my patients to remember. We're here to prevent, we're here to detect early, of course, that means complications, and we're here to control. And by doing those three things, after over 20 years of experience, I see how patients become more at ease. Because remember, disease is a body that is not at ease. And basically, we give our patients peace of mind. So remember, with the three keywords, I'm going to explain them one by one. So we're here to prevent, detect, and control. And we're here to prevent what? Well, let me explain how diabetes alters your body function. So you and I know that every time that we eat, food needs to come from, it needs to go somewhere. It goes through your mouth, it goes through your esophagus, it goes to your stomach, and then it goes to your small intestine. And from there, all those nutrients, I'm talking about the main ones, proteins, sugars, and also known as carbohydrates and fats, they get broken down all the way down. So the sugars, when they get broken down, their name or their term changes. And the term that we use in medicine is called glucose instead of sugar. It's the same thing. It's just a little particle of sugar, as well as proteins that turn into amino acids as well. Little particles of the same thing. And of course, fats turn into something called fatty acids and cholesterol. All of that, it gets broken down. It gets absorbed in your small intestine. It goes through your vessels. And from there, as you already know, gets distributed across your body to nurture the rest of your cells in your body. But unfortunately, the system, as we get older, the system that picks up all those nutrients is not working as good as it used to. So all that food remains longer inside your vessels. And I know you know this, your vessels are just the pipes that carry your nutrients and your red blood cells that carry oxygen. So see it this way. When the sugar is really high inside your vessels, especially in your arterial system, which is arterial for air, A for air, that's where your oxygen goes through your red blood cells, inside your red blood cells, and it gets delivered. So if you have too much sugar, I know you know this, sugar is sticky. Have you ever had orange juice spill in your hands and it gets really sticky? So the same thing, having high sugar inside your blood vessels is going to start sticking to those vessels. And I know, as far as talking to my colleagues, there's more to that, but I'm just making it simple for you to understand. So those vessels, through time, become dirty, or that stuff sticks to it, and the lumen, the space, becomes reduced. And that is why we have complications. And if it happens that space inside those vessels is reduced and the red blood cells going to go through that, then unfortunately, anything downstream, anything after the obstruction is going to be affected. If it happens in your heart, we call that a heart attack. If it happens in your brain, we call that a brain attack. Or also we know that as a stroke. If it happens in your legs, you may have lack of blood flow going to your feet, and then we end up having an amputation, which we want to prevent. As well as, eye problems, kidney problems, and of course, nerve problems. Yes, even your nerves have vessels that get obstructed with high blood levels or sugar. But again, it's not only the sugar. Most people think it's a sugar problem. No, it's an everything problem. I mean, sugar, the cholesterol, the proteins, all of those elements are not being absorbed or picked up in a timely manner right away, and they linger inside your vessels. So remember that prevention, the word is very ambiguous. So I tend to explain this to our patients here in our office, our clinic, is that we are attempting to delay or avoid something from happening. And remember that, delay or avoid, because even though you and I, we don't want to admit it sometimes, we're not eternal. So we're not going to live forever, but we're attempting to see what we can do today to get another day, another week, another month, another 10 years here with our loved ones, so we take care of ourselves. Now, going back to the word prevention. So most of our patients don't understand what I mean by that when I'm treating them, because sometimes they come and ask me, Dr. Steele, when am I taking these pills? Like the cholesterol medication that already, the aspirin sometimes. And they're like, I've been taking this for 10 years, Dr. Steele, and I don't want to take it anymore. And my question to them is, why not? Because I don't feel anything. Well, I know you don't feel anything, but let me ask you a question. Have you ever felt a heart attack? And they look at me and say, no. What about a stroke? Have you ever had one? No. Well, that's the reason you're taking those medications, for you not to have those things, for you not to feel those things. So sometimes the mindset is not understood that we take those pills to delay those complications or avoid them, right? In my world, in medicine, for me, no news is good news, as you know. But let me explain also about prevention. We talked about that, but control. What do I mean by control? Well, three things are the main ones, right? That everybody knows. Everybody. If I talk to any of our patients, they already know three things that need to be controlled all the time for this, for them to live longer. So that's diabetes, that. Cholesterol, that's a big one. And of course, high blood pressure, also known as hypertension, because all those elements or those alterations or those imbalances, they actually damage those vessels. And now let me talk to you about detecting early. Detecting what early? Well, you remember I just explained to you that unfortunately diabetes, the end result is a vascular problem, that your vessels get clogged through time. Where we want to detect those complications way before there's nothing for us to be able to do. As you know, we right now at this time, and I always tell my patients, we live in an era of miracles, because 80 years ago, I'm talking about 1940, is when antibodies were first introduced in mass, penicillin. Back in the day, we have no ways to do certain surgeries, certain procedures, because infections will set in. So it's only been 80 years. So during those 80 years, we are able to do now not minimal invasive, sometimes a little bit more invasive, but most of them little invasive procedures that open up those vessels if stuff is building up For instance, your carotids, the vessels that feed your brain, and it's called carotids for face in Spanish, cara, and your brain. We have ways to open those up and prevent a stroke. We also have ways to test for, lower extremity problems like circulation problems. And if we find them, we're able to do also techniques to open those up if we have to avoid amputations. And as you know, we also have things, that procedures that we can, not only we can testing, but procedures to open those vessels in the heart. That I have a lot of family members that already have bypass surgeries, cardiac caths, and they're here talking to us still. So again, as I tell my patients, the fish doesn't recognize us in the water until it comes out of the water. And the same thing with us. We're not going to recognize how wonderful or how many advancements we have made because we see them just as, just another normal thing. But no, we're very blessed to have diabetes now because before we had nothing to offer. We have different options to control it. And we have a lot of testing that we can do to avoid delayed complications or try to avoid losing your feet or avoid a heart attack or a stroke. And of course, we also have tests to check the other things, the IX that we have, robotic instruments to check the eye. We have studies that check your nerves and of course, nerves. And we also have studies that check your kidney, right? So all that is guided towards to preventing, delaying complications. So I just want to leave you with that. Just think about this. We're here to take medications, but the lifestyle change of the diet and exercise has to be there for this to be successful, that we're going to teach you here in our office, in our clinic. But also remember this, that if we prevent and we early detect and we control, there's no way you're not going to live another minute, another hour, another day, another week, another month, another year, another 10 years. Who knows? But I know for certain, if you don't do anything, you're going to live less time here in this earth or with complications that could have been avoided. So anyways, that was my message for today. I'm going to be coming up with different ways to explain why we do what we do here in our clinic. And if you like this, please like us on Facebook and click like. If you have comments or anything you want me to discuss next time about diabetes, let me know. And I'm just going to go see our patients and have a blessed day. And thank you for listening to this message because I think it's important. Have a fantastic day. Okay.